Hello, everyone. We're going to wait just a minute or two while folks join us, and then we'll be getting started soon. Okay, hello everyone. Thank you for joining us for our first virtual chat with Counseling and Psychological Services. My name is Catherine Mandalakis, and I'm the Assistant Director of the Fordham Fund for Family Giving and Engagement. Real quick, I just want to speak for our little group here today in saying that we know it's been a very unusual year for your students, and we acknowledge the struggles and the stressors that they've had to face. Despite that, we're also incredibly proud of the resilience that they've shown and look forward to the light at the end of the tunnel, and hopefully more semester come the fall. So we do have a lot to cover in today's webinar. Before we get started, I want to introduce our panel for today. Joining us, we have Dr. Jeffrey Eng, Director of Counseling and Psychological Services, and Dr. Yael Uness, Associate Director of Counseling and Psychological Services. Thank you both for being here with us this evening. Just a few quick housekeeping items before we get started. Today's webinar will begin with a presentation on recent trends within the counseling and psychological services space, as well as resources available for our students and parents, followed by a Q&A portion. I do want to mention that if you have any questions regarding your students' specific needs or concerns, please feel free to reach out to the CPS team directly, and they will provide support for your unique situation. We will try to answer all pre-submitted questions first, but if you have any questions during today's webinar, please use the Q&A function, located at the bottom of your Zoom screen. And with that, I'm going to turn it over to Jeff to get us started for today.
Thanks so much, Catherine. Catherine, can you just nod to confirm that you can hear me? Okay, great. So thanks again, Catherine, for the introduction. And thank you all so much for joining us tonight and for your interest in learning more about and supporting our students' mental health and well-being, which, as I imagine you all know, are very much connected with their capacities to learn and flourish, both while they're at Fordham and, beyond their years at Fordham. Thank you also to those of you who submitted questions in advance of this webinar. We received about 10 pages of questions, which clearly reflect the saliency of mental health in the lives of our students right now. As Catherine mentioned, we'll do our best to get to as many of these questions as possible during our presentation and Q&A, but we recognize that we likely won't get to all of them since we only have about an hour tonight. So if we don't get to your specific question, please feel free to reach out to us afterwards at the email addresses that you see on this slide here. So as Catherine mentioned, I'll be starting us off tonight by providing you all with an overview of the mental health concerns and trends that we've been seeing and working with on the ground, both prior to and during the COVID-19 pandemic, as well as within the context of the more long-standing and insidious pandemics of racism and other forms of social injustices. And then my colleague, Dr. Yael Uness, who is the Associate Director at our LC office, will provide you all with some recommendations and suggestions for how we may be able to more effectively protect and support our students' mental health as parents, caregivers, and family members. So let me just start by naming and normalizing what I think is probably glaringly obvious, which is that this has been an extraordinarily challenging and tumultuous past year for our students, and likely for many of us. Thank you, Catherine, for just acknowledging that earlier. I think with that said, it's also important for us to keep in mind that the mental health of our students collectively was already somewhat concerning and precarious, right, even before the pandemic, which you can see, oops, I'm trying to get to my next slide here, which you can see in this slide, hopefully, from the data on this slide, which is from the American College Health Association's 2019 College Health Assessment Survey of over 70,000 students. And again, this is data pre-pandemic. Okay. Now, according to that data, 66% of college-age students experienced overwhelming anxiety within the past year. 45% endorsed feeling so depressed in the past year that it was difficult to function. 30% reported some form of substance abuse and dependence. 31% reported having experienced trauma at least once in their lifetimes. 27% reported experiencing body image and eating concerns at least once in the past year. And this one is just quite sad to me, which is that 66%, right, 2/3 of our college-age students reported feeling, very lonely at some point during the past year. We know that those numbers have increased in the context of the COVID-19 pandemic. And here are some, numbers that are quite concerning and humbling, right? That 13% of our college-age students reported experiencing seriously considering suicide at least once in the past year. 9% reported experiencing non-suicidal self-injury, and 2% reported that they made a suicide attempt, at least one suicide attempt in the past 12 months. Now, 2% may not seem like an extraordinarily high number, right? But on a campus like Fordham, where there are approximately 16,000 students, right, it translates into over 300 students who have made at least one suicide attempt in the past year. And then lastly, the data from that survey demonstrates that 87%, right, almost 9 in 10 college students reported feeling overwhelmed by all they had to do in the past year. And here are some of the stressors, right, and demands that they described feeling overwhelmed by. And again, this is prior to the onset of the COVID-19 pandemic. So they understandably report experiencing, challenges with normal developmental issues, things like establishing their identity, their independence, their relationships. They experience family and cultural pressures and expectations. Obviously, on college, they're experiencing academic, internship, extracurricular, and athletic demands. And some of our students, in particular, our first-generation students and our freshman students, our transfer students, are experiencing acculturation and adjustment stress. And increasingly, our students are reporting more distress around, social injustices and identity-based stressors, both on a micro and a macro level. Now, these are stressors that are not unique to just today's college students. I imagine many of you experienced these demands and pressures and challenges while you were in college. But there are at least 3 challenges that are unique to today's college students. And I'll name what those are right now. The first is the existential concerns and implications of climate change, which weighs quite heavily on the minds and psyches of many of our students. The second is the exorbitant cost of higher education and the subsequent employment prospects. And as parents and family members, I'm sure you don't need me to highlight this particular challenge. The third stressor that I think is quite unique to today's college students is really the ubiquity of technology and social media in the lives of our students. We know that technology and social media can be a real asset, right, and a real resource for our students, but for too many of them, it's also a source of distress. And we could spend, a whole day talking about, the implications of technology and social media on our students' mental health, but we just don't have the time to delve into that right now. There is a great book entitled "Have Smartphones Destroyed a Generation" by Jean Twenge that you all can take a look at to learn more about the sociological trends, right, that we've been seeing in the last 10 to 15 years as it relates to social media, technology, and student mental health and well-being. Now, all of these challenges that our students were already contending with happened prior to the pandemic. And as we all know, right, during this past year, right, our students had to learn how to navigate, right, a once in a lifetime global health crisis. And it's a crisis that has, as I think you all recognize, has created countless disruptions and losses for them and for many of us. And one of the things that we don't talk enough about when it comes to losses is that loss usually results in a process of grieving and mourning. And I imagine many of our students, I know that many of our students, and I imagine many of us are still in the process, right, of grieving and reconciling and mourning all of the losses that we've experienced this past year. And before I say more about the phenomenology and the experience of grief, I think it's important to remember that most of our students, because of their youth, right, have fortunately not had to experience too many unexpected or significant losses in their lives. They have not had to, grapple with things like impermanence or uncertainty or death and grief, like, some of us older folks have, myself included. Most of our students, I suspect, are likely even more emotionally unprepared and caught off guard than we ourselves may have been by all the abrupt and sudden losses that unfolded this past year. All of which is to say that most of our students are likely, again, still in the process of mourning and grieving. And there are some common, expected, and predictable experiences of grief, that are captured in this next slide here. The first three are denial, anger, and bargaining, which, we saw many of our students experience back in the spring of 2020. Not just our students, but, many folks in our lives were initially in denial and shock, and then angry about the disruptions and the restrictions. And a good number of us also, proceeded into this stage of bargaining, right? Trying to figure out ways to navigate and circumvent the reality of the situation. I think most of us have proceeded past, denial, anger, and bargaining right now. And based on what we are hearing and seeing on the ground with our students, most of them are currently experiencing this sort of depressive feature or dimension of grief. They are understandably still feeling and processing, all the sadness, right, about all the little and not so little things that they've lost in the past year. Losses to their routines, to their plans and their expectations, right? Losses of milestones and rites of passages and celebrations. Loss of interpersonal relationships and connections, right? And of the physical and emotional intimacy that has been created by physical distancing. And as you all know, many of our students have also lost significant parts of their expected college experience, right? Things like in-person learning, right? Or living and engaging on campus. We know plenty of students who are supposed to study abroad who were not able to do so and may not be able to do so during their college careers. Know a lot of student athletes who've lost their athletic seasons. Right, and as we all know, some of our students have sadly also lost, family members and loved ones to COVID. Now, the expectation, of course, in this sort of stages of grief model is that most of us and most of our students will gradually move to a place of acceptance and reconciliation of all these losses, which we know will eventually lead to existential growth and resiliency and meaning making. This shift, though, to acceptance and reconciliation has been made a bit more complicated, right? Because of the nature of the pandemic, right? The uncertain nature and duration of the pandemic, which has contributed to what we refer to as anticipatory grief, right? This sense of uncertainty about what the future holds, sense of foreboding, dread, and apprehension, a loss of perceived safety. I think we are all grateful to have a little bit more certainty now, with the rollout of the pandemic and, with some planning in place for the upcoming summer and fall. So hopefully, the anticipatory grief will de-escalate a bit and our students and ourselves will be able to move a little bit more gradually, to that stage of acceptance and reconciliation. Now, the specific implications of the pandemic on the mental health of our students are still emerging, but here are some preliminary findings that we do have. First, Oops. And this is data from the Center for Collegiate Mental Health. We know from this research that for about 60% of our students, the pandemic has most negatively impacted their mental health, their motivation, and their sense of connectedness and their academic functioning. And this aligns with what we're seeing on the ground, right? That this past year has had a significant impact on students, ability to be motivated and to stay engaged. They're reporting increased experiences of loneliness and isolation. And obviously that is all having an impact on their mental health and well-being. We also know from this large-scale Stress in America survey that was conducted by the American Psychological Association in October of 2020, right, that Gen Z adults, right, which is the generation that most of our undergraduate traditional college-age students are part of, that Gen Z adults are reporting disproportionately higher levels of stress relative to other generations and higher levels of anxiety and depression. And specifically, about 3/4 of Gen Z adults are endorsing experiences that we know are clinical indicators of depression. And not surprisingly, we know that Gen Z adults are especially stressed about their current and future educational and academic experiences, as this slide shows. Now, the conversation about the COVID-19 health pandemic, as we know, is not disconnected from the conversation about racial injustice and other forms of systemic oppression and inequity. We know, for example, that populations that are more marginalized and disenfranchised have been, and sadly continue to be, disproportionately impacted by COVID-19, right? Due in part to the many identity-based structural inequities and stressors that they have to confront on a daily basis. And it's important for us to remember that our students are not immune from these same inequities and stressors, and that they too, right, have to navigate them on an individual, interpersonal, and systemic level. And here's a slide with a snapshot of what some of these identity-based stressors are. The first is experiencing direct, vicarious, and intergenerational trauma as a result of one's identity, whether it's their racial or their ethnic identity, or their sexual orientation identity, et cetera. And we know that many of our students are also reporting and experiencing manifestations of biases and prejudices, stereotypes, or being stereotyped, and experiencing microaggressions, which are, by definition, these subtle verbal or behavioral slights or invalidations. Many of our marginalized students also report being troubled by the lack of representation on campus, right? Of not seeing enough faculty, staff, or peers that look like them or represent their identities or backgrounds, which, as you can imagine, has an impact on their sense of belongingness. And again, this is especially relevant maybe for our first generation students, right, who have to sort of shift between the norms and behaviors, right, and expectations in their community or families of origin, and what might be expected of them on campus and at school. This code switching requires mental effort and energy. And lastly, our students also have to function, right, in micro and macro spaces where systemic and structural discrimination, marginalization, and inequity continue to exist. And this is a reality that we as an institution and nation have to continue acknowledging, reconciling, and addressing. All of these identity-based stressors do have an impact on the psychological and mental health sequela of our students. And I think it's important to keep that in mind. Again, we don't have time today for me to delve into how all of this has an impact on their mental health and well-being. But if this is something that anyone ever wants to speak more directly about, please feel free to reach out to either myself or Yael Uness. So I'm going to pass the baton now to Dr. Uness, who will speak more about recommendations for how we can all more effectively support our students.
Okay, hopefully everybody can hear me. Thanks for coming to speak with us and to listen to our presentation this evening. I'm feeling lucky because Jeff had mentioned sort of some of the challenges and difficulties that our students are facing, especially during this time, and I get to talk about sort of some of the sort of more positive side of it around protecting mental health and striving toward health. The first area I want to speak about is treating oneself and others with care and compassion as a way to enhance mental health. So this includes a bunch of different components. One is to attend to basic needs, including sleep, nutrition, and exercise. The next is to attend to mental health needs by seeking support from maybe a therapist, normalizing help seeking, and by acknowledging emotions. So I like to think of emotions as sources of useful information, and we can benefit from really understanding our emotions, but not as much if we are not acknowledging. Attending to faith and spirituality. Being kinder and more patient with ourselves and with others. Being flexible with expectations and goals, and setting reasonable boundaries for ourselves and with others. So sometimes that requires a little bit of thought in terms of recognizing where boundaries might be better placed. And finally, to acknowledge, learn about, and to address one's own biases to reduce stereotyping, microaggressions, and discrimination, which can be a significant source of stress, as Jeff was mentioning previously. So next I want to talk about some, further talk about strategies for coping and for protecting mental health as it relates to sustaining social and relational connections. So it's important to keep in mind that social distancing involves physical distancing, but not necessarily, it doesn't have to involve relational or emotional distancing. So I like this graphic because I think it's a cute example of how we can connect despite the physical separation that we might have from others. And as I'm sure you all may be aware, especially in engaging with your student, technology provides us with ways to create and maintain connections to others without being in physical proximity. So an example of that is Netflix Party, a way to connect through technology with others. Okay. So other ways to protect mental health have to do with kind of what we focus on and like what is in our minds at any moment. So for some people, it can be important to limit and monitor social media and news consumption. It can really sort of like pull one in sometimes to focus on the news and how can, we can think about how we can balance staying informed but not being flooded or overwhelmed, because that can be experienced by people sometimes as vicarious trauma. And it also increases the likelihood that our emotional and behavioral responses are proportional to actual rather than hypothetical and sensationalized situations. So managing or balancing that can be really important. Sometimes we can get carried away with focusing on things that we can't control. So as highlighted in the graphic below, there are certain things that we can control and other things that we can't. So if we sort of have the focus or able to highlight the things that we can control, then that can be helpful as well. Okay, and I wanted to address one of the items that have been sort of a question that we've received in advance of the presentation. Students and also, as we all know, parents can have a lot on their plates. Living in a pandemic situation can take an emotional toll, and one of the things that can happen is that motivation can be affected. So I want to also talk about coping and about protecting mental health in the context of time management and motivation. So I'm going to provide some suggestions in this regard for those of you who have asked about that. The first is to determine how much available time you have. So it's sort of a balance. It might seem like contradictory advice, but for some people, you may be able to generate or have more time than you think if you think about your time in a strategic way. But also beware of taking on too much, which some can have a tendency to do. Setting routines and structure or making a plan can be helpful. People enjoy using different types of calendars or calendar electronic functions, and you can set reminders. Making task lists, some people do that already. Some people would benefit from maybe introducing that and prioritizing the most important or the most urgent tasks. This relates maybe more to students as I think of it, and how you might relate to information that relating to academics. Recording what you need to know and listen to on your phone. Finding ways to decrease distractions. And organizing your space. So there's a psychological principle involving like linking a behavior with specific environmental conditions. If you do conduct a certain behavior regularly in a certain space, then that can help with time management and with motivation. Some of you might have heard the example of like, you know, try to stick with not studying in your bed, but sleeping in your bed as an example of that as well. Okay. So that's my quick overview regarding kind of how we might encourage individuals to work on coping in potentially different ways, and that will inevitably help to protect mental health. And still, you know, we recognize that there are times when people can really struggle with quite severe or serious mental health conditions and concerns. So I'm going to bring up a list here of ways to recognize signs and symptoms of emerging or worsening mental health concerns. And then I'm going to address a little bit about how we at Fordham have some supports in place to help students with these type of you know, increased level of concerns. So these signs and symptoms include persistent sadness, anxiety, anger, hopelessness, worthlessness, or feelings of being overwhelmed. Sustained loss of interest in pleasurable or social activities. Significant impairments or changes in daily functioning, like sleep, getting out of bed, appetite, eating, concentration, or hygiene. Impulsive, reckless, or risky behaviors, for example, substance abuse that is out of control, self-injury. And lastly, we put down here thoughts or expressions about dying, death, and suicide, which is something that obviously we would want to know about. So we feel that you can really be an access point for connecting students to resources such as CPS. I really strongly encourage you to check out our website. There's a lot of information around our services, around resources available there. So this is some information about our hours, our location, our contact information. Our services are free, confidential, and equity-based. And when students connect with our office, the first step is of what we call a phone triage, which is a 15 to 20-minute screening, in which one of our trained clinical psychologists calls a student and has a conversation just about what's bringing them into the office, going through some routine questions to assess for certain key areas, to assess for various different risk factors. And then we shift the conversation to have a plan with students about which of our services might be most helpful, what they might be interested in, and we give our best clinical recommendation based on the triage process. So if I have time, I'm going to go over a list of some of our main services. This is one of my beefs or comments that I always have, which is we become sort of known for the first of our services on this list, which is short-term and weekly individual counseling. And sometimes people inaccurately perceive that that's all we're offering at CPS. So I wanted to really emphasize in this list, sort of, we have a really significant menu of different services, and we want students to be able to take advantage of multiple services, or as many of them as they feel might be helpful. So recently, we've introduced another short-term individual counseling modality, which is short-term weekly coping skills training. So that's, for right now, we're focusing on sessions that focus on either stress and anxiety, or reducing intense emotions. And that involves matching up a student with a counselor also for individual 3 weekly sessions once a week. We have an extensive group counseling program. We have groups for a bunch of different demographics and populations, and that's an example of our long-term service. I love groups, and I've had students who have been in my groups for 2 or 3 years, which is great, and they can continue to do so as long as they're a Fordham student. Some students might benefit from regular ongoing therapy or services outside of our office. And we call that process transition to referrals, because we follow up on a weekly or on a regular basis, because we really want to make sure that students are able to connect with another therapist in the community who, let's say, specializes in an area that they want help with. And we try to stay connected with the students to the best of our ability to make sure that they make that connection on the other side. With someone in the community. We offer short-term psychiatric services, so medication management and prescription. We have many different outreach and prevention programs and workshops offered by our really excellent outreach staff. Certainly we're available in a crisis. So we offer same-day walk-ins for someone who feels that they're in an urgent situation. And we offer consultation with community members. I feel that last one is one that sort of gets a little bit not as recognized or left out sometimes. But for that reason, I want to go to the next slide, in which I encourage you all. This is similar to what Catherine raised at the beginning of the presentation, but please feel free to contact us. You're welcome to contact me or Jeff or other staff members within our office to consult on individual cases. We would be more than happy to take some time to discuss in detail a situation with a particular individual student, and to make our recommendations or suggestions about kind of how to approach concerns or what might be most helpful for the student. I wanted to share this link as well for a series of videos developed by Jeff as well as some of our colleagues for supporting parents and their children or student. And lastly, I want to bring up sort of Fordham's community of care, because I really want to emphasize that this work is not done only through the Counseling and Psychological Services office, but there are so many different offices within our community that provide a lot of support and help for students. So this is the list, including parents and families. So I will stop sharing my screen now.
Thank you very much, Yael and Jeff. Really appreciated that presentation. And for everyone who's attending today, I did just want to let you know that we'll be including the slides as well as the recording in a follow-up email after the session is finished today. So you're free to rewatch, to read through those slides and click on some of those links, either with data or like Yael just shared, some of those Fordham links specifically for additional materials and additional resources. So I did want to begin addressing some of the questions that we've received. First question is a little bit about off-campus versus on-campus students. So students in dorms have more regular interaction with RAs who are hopefully trained and a source of support. So how does the university ensure that students living off-campus, either as commuters or in the Bronx or Lincoln Center communities, are able to reach out for support if needed?
That's a great question, Catherine, and whoever it was out there in the the web sphere that posed that question. There is not just one strategy that we implement, for trying to connect with students who are not physically on campus right now. There are really multiple strategies, including really connecting with our colleagues and other constituents on campus who have those day-to-day and more frequent interactions with commuters and students who are not physically on campus. Some of the ones that come to mind for me right now are, our commuter student associations on both campuses, the folks within the Office for Student Involvement, right, who are dedicated to supporting and developing programming for commuters. working with our academic deans and our academic advisors who have, more frequent contact with commuters. And so it's really important, for us from a, holistic care perspective, to have as many folks as possible within the Fordham community who have their eyes on not just students who are living on campus, right? But, students who are learning remotely, students who are really, anywhere across the globe.
Thank you, Jeff.
Yeah. Catherine, there was a question in the Q&A. Can I answer that one?
Absolutely.
Yeah, I began typing an answer and it's just too complicated to type.
Sure.
There was a question about, and this comes up a lot, which is why I really wanted to address it. There was a question about, how to encourage, right, my child or my student to reach out for help when they're resistant to it, right? And obviously, as Yael mentioned, we can certainly provide more individualized consultation to any parent or caregiver who is experiencing that dilemma with their child. But some general recommendations, at least from my perspective, would be, and it's especially tricky at this age, right? When they're young adults and they're, some of them are teenagers, right? And, their autonomy and their sovereignty and their independence are so important to them. And sometimes the more we push, right, the further away they go, paradoxically. And so I would encourage folks to sort of gently encourage their students to seek help if they suspect that they need it, and to be curious, right, about what the resistance is about. What is the reservation or what is the barrier for them, right, to reach out? For some of our students, it's because, they feel ashamed or they associate help seeking as a weakness, right? And, we hear that a lot. There's a lot of stigma around seeking help. And if that's what you're hearing, I would do my very best to try to normalize for them, that seeking help is actually a strength rather than a weakness, to let them know, what some of the data is, right, that I just presented to you, right, that you're not the only one, right, to try to make this seem like a more universal experience, right, and to just normalize vulnerability, right, especially now in this current context where, there are so many demands and changes that our students are reckoning with. Did you want to add anything to that, Yael?
Nothing's coming to mind at the moment. That sounds
okay. Yeah. We also encourage parents sometimes to introduce their students to one of our staff, via email, as a sort of gradual way to get to know us a little better, rather than having to commit formally to any kind of treatment or therapy. We also tell parents and students to come to one of our events, where it is a little bit more informal. We do a lot of trainings and webinars and workshops on campus where they can get to know us a little bit. So it's a sort of more gradual transition into seeing someone in our office rather than going from nothing to being in therapy, which we know can be a little jarring for some of our students.
Sure. Thank you for that. That's actually a really good segue into the next question. A lot of our parents have been looking for some more clarification on the 10-session limit for speaking with a therapist. And I just wanted to see if you could provide some more clarification for what that means, if there's assistance in transitioning to an outside therapist or psychiatrist after those 10 sessions are over, if there's possibility to continue past the 10, and how all of that interacts with students' insurance plans.
Sure. So I would be happy to speak to that, and that sort of has to do with a little bit the slide that I was talking about when I mentioned our different services. So yes, there can be this perspective that we offered 10 sessions and somehow that number became very widespread within the community. So that's a description of our short-term inside-oriented supportive psychodynamic therapy. And often students do take advantage of that in terms of us matching them up with a counselor and meeting for, about 10 weeks of ongoing sessions. That is only one of the many services that we offer, including the other option for short-term counseling, the long-term referral option, group counseling, and walk-ins and all kinds of the other services that I mentioned. And so there were many parts of that question, and I feel like I'm losing the last couple parts there.
That's okay. Just specifics about, are they able to continue further than 10 in that specific resource that you provide? And if they do, how does that interact with the student's insurance?
Right. So our services are free and we do not bill to insurance at all. Insurance comes in if we were to refer somebody to an outside provider, in which case we attempt, if they would like to be connected with somebody who takes their insurance, that they can do that. What we do is, because of the theoretical basis and orientation of what we're providing, the 10 weeks is sort of like our model for the short-term counseling. So, what we're trying to do is we're trying to work with them within the 10 weeks, if we feel that it's reasonable, to address whatever their incoming concerns were. And we offer that 10 weeks in order to accommodate all the students who express interest and who have the type of concerns that they're presenting with that fit well within that model. I mentioned sort of the equity-based nature of our services. When students are unable to connect with outside services for many different reasons, but a big one might be financial, we make sure that we can help them and support them. There may be situations where students are seen for sort of long-term individual counseling. And also there's a lot of questions here, and trying to navigate between the open questions and the answer questions tab. But I really just want to say in general, in response to one of these questions, that I strongly encourage students, that I hear it from a lot of students and faculty and people on campus, that they encounter, that they say, oh, I'm done with my 10 free sessions, at CPS. And I really discourage people from thinking in that way about our services and from having that perspective, because I really want people to reach out to us and reach out to me specifically, if that would help, to have a person who is known to them and who is familiar to them, and discuss what other services are available. So I really encourage people to not think of us as only offering this short-term 10 sessions of individual therapy, but to think about other types of short-term and long-term individual and group sessions or services that we offer.
Thank you, Yael. Jeff, did you want to add anything to that question?
No, I think that covers it.
Wonderful.
Yeah.
Next, we've been receiving quite a few questions from parents, specifically of freshman students this year. Just wondering if there have been any freshman specific programming, or if there are hopes to do so come the fall, as obviously freshmen face mental health issues and changes just for being a freshman. And of course, all of those were different this year, as it wasn't a traditional college freshman year experience.
Yeah.
So do you have any plans in the works for that specific class?
Yeah, I had a slide that I didn't wind up showing just because I was trying to be thoughtful about time. And it was a slide on, students who might be especially vulnerable right now. And first year students, like freshmen and transfer students, were on the top of that list. And it's been hard for freshmen, right? This is their first year is oftentimes their opportunity to connect, right, with peers, with friends, with roommates, with classmates, with advisors, with faculty members. And that's been made so much more difficult, right, this year, especially if they're not physically on campus. We're aware of that. We are not directly involved in overseeing that kind of programming, right, for establishing connections and relationships on campus, but there are many other offices that are. And I know that they are, working night and day to try to develop programming, right, to support our new students, our freshman students. We've talked about developing support groups for, first year students. And, whenever we get that threshold for the number of students that want to be part of those groups, we will run them. And so we're certainly open to, developing specific mental health services, for incoming students.
Thank you, Jeff. Next question is a little bit more about some of the group sessions that you were telling us about earlier. How have those been working given this virtual hybrid, sometimes in-person nature that COVID has given us?
Yeah, so, I also coordinate the group therapy program within our office. And we've had some good success offering our groups, which have been remote on Zoom for this year, since the pandemic started. We find that we're still able to run the groups that we have, including an undergrad group, grad student group, and also population specific ones, including like the women of color group, LGBT, et cetera. And we definitely, as Jeff had just mentioned, offer a freshman adjustment group as well. It's not one that is currently running, but as Jeff was saying, when we have students who are interested in the freshman or the adjustment group therapy group, then we offer that as well. One advantage has been that hasn't been present in the past when we had our real in-person groups, has been that we didn't have the same opportunity for cross-campus participation. So now we're able to, because it's on Zoom, you don't have to be there in person. So we're often making referrals to another campus, which may have a group that might not be on our campus. So even actually this morning, I spoke with a student who was interested in a grad student group. I only have undergrad student groups at Lincoln Center running right now, but referred the person to Rose Hill to participate in the group therapy program. So that's been a cool advantage.
I'll just add that groups have actually been flourishing during the pandemic. When we transitioned to providing exclusively remote services in the spring, we had no idea how we were going to run groups, right? Like what we're doing right now, we were not familiar with, right? But we were able to figure it out, with some practice. And we were quite surprised by how many students were receptive to participating in a virtual group. And hopefully we will transition to offering, more in-person group experiences in the fall. We're all keeping our fingers crossed that we can do that. We have been seeing students in person individually, with all the mitigation practices in place, obviously, but we haven't quite transitioned to providing groups yet in person for all the reasons that we know of.
Sure, it's wonderful to hear that those are really flourishing now, though, especially as we're all dealing with not being able to see groups. So participating in that way must be really special and important during this time.
Yeah.
Concerning that question of stigma surrounding mental health issues, one of our attendees today is wondering if there are ways for students to attend workshops or different programming by CPS anonymously rather than non-anonymously.
I think so, because we are doing a lot of our group workshops on Zoom. One, they can just hide their video, right? I guess they would also have to change their name, right? In their profile so that we don't know who they are. But certainly students can attend the workshops that we offer with as little visibility and exposure as possible.
Great, thank you. Another question about the structure of CPS. How many counselors do you have available to work with students at one time? If a student reaches out, will they be able to receive help fairly quickly, or is there a bit of a waiting time?
Yeah, that's a great question. Right now, there isn't much of a wait time. Surprisingly, well, not really surprisingly, but interestingly, our utilization has been a bit lower this academic year than it historically has been. We attribute that in part to the fact that, there's so fewer students on campus right now. And because of that sort of slightly lower utilization rate, we don't really have a wait right now for students to be assigned to a counselor. During non-COVID times, it would depend on a number of different factors, right? Including when they reach out to us during the course of the year. And also, one of the primary factors that contributes to how quickly a student can be assigned to a counselor is what their own availabilities are, right? We have students who, we screen, and they tell us they have 1 hour during the course of the week where they can participate in counseling or therapy. And that doesn't give us a lot of flexibility. It might be an hour where all of our counselors are booked, for the foreseeable future. So it really depends on a lot of different variables. But right now, for most students, there isn't a significant wait to be assigned to a counselor. And there's never a significant wait to schedule a phone screening appointment. We usually get students seen for a screening or triage appointment, within 24 to 36 hours.
That's wonderful. And also, this is not a question from one of our attendees, but before we began this session, Yael and Jeff were talking about some of the walk-ins that they do. And if you could just mention briefly, if a student walks into one of your offices, what that process might be and how quickly that turnaround time might be, because that's also an option.
Sure. So we are in almost every case that I can think of able to accommodate same-day walk-ins. So walk-ins can contact us. Sometimes we've also kind of ventured into the virtual walk-in area, which is different than what we've experienced pre-pandemic. But anyone who is in distress or feels that they're suffering from an urgent situation or an emergency can walk into our office. We recognize that these people are in heightened distress, so we don't require a big process or a lot. We provide them with a brief walk-in form that is essentially 7 check boxes so that we can get a sense of what brings them in. And we are, in really most cases, able to accommodate them in the during the day in a time that they're available, like not in class or able to be seen.
Thank you, Yael. This is a question specifically for our parents of student athletes. Are there trainings or resources specifically for students who are dealing both with the stressors of academic work, friendships, COVID, on top of a sport this year? Is that provided to teams or trainers, or do they have different resources that they can use?
Yeah, that's a great question, and I'll take that one, Yael, if you're okay with it, since I work at the Rose Hill campus as well. Yeah, the athletics department has dedicated and specialized mental health services for their student athletes. And part of that package of services includes someone from our office who specializes in working with student athletes. But in addition to one of our staff members, from our office, they've also partnered with a number of other mental health providers to support their students as optimally as possible. There are also a number of peer-to-peer led support services within athletics. And I know there was a question about this from one of the family members, from one of the participants, about Fordham Connect. Fordham Connect is a athletics run peer-to-peer program for supporting students' mental health. And it's been going really well from what I hear.
Great, thank you, Jeff. I want to be cognizant of everyone's time. It's a lot to cover in one session. We do have 6 minutes left, so we'll try to get through 1 or 2 more questions. This is just a clarifying question. Are all services that are being offered traditionally also being offered in a virtual format for this semester as well as over the summer?
Can you just repeat that? I'm trying to answer questions in the QA as well.
No problem.
Yes. The short answer is yes. We are planning in the summer to have our services also offered virtually, the same services that we are currently offering.
Wonderful. Thank you.
Yeah, that being said, if I can chime in there, Catherine and Yael, there were some concerns about students' reticence and fears and anxieties about returning back to campus more fully. And I think that kind of relates also to your question about what kinds of services will be offered in the summer and the fall, right? We're going to customize our scope of service and our service delivery based on where students are at, right? We hope that students, return fully to campus in the fall. And we understand, the anxieties, right, that they might be carrying with them about returning. and at some point, right, we're going to have to make the transition, right, to returning to, sort of pre-COVID, pre-pandemic life. And I know that's going to look differently for everyone. But what I can tell everyone on this call is that the university is going to do as much as they can and everything they can to ensure that students are able to return as safely and securely as possible. And I do think that we trust that the rollout of the vaccination program will be vast and broad, and will be conducive to students feeling, more safe and more secure as they return. One of the things that we didn't really get a chance to talk about is that, one of the ways that we counteract and treat anxiety is through, systematic exposure, right? Whether it's a phobia or, a virus, right? When that threat is no longer real, right, and it's more internalized, one of the ways that we combat it and confront it is not by shying away from it or by avoiding it, right, but by gradually exposing ourselves to those things that we're fearful of. And so I would encourage, parents, who have children who are understandably right now scared to come back, right, to gradually lean into those fears and those worries, while also being mindful of, what the real threats are, right?
Yeah, thank you for saying that, Jeff. We are definitely trying to do everything we can for when things are normal, and also during this time while we have to pivot and make sure everybody stays safe. So thank you for saying those words. For our last question, I would love to hear from both of you. This is tough to do, but if you could give one piece of advice to all of our families and parents here today for how to support their child through these tough times and through college, what would that piece of advice be?
I have a quick and easy answer for that. Maybe not so easy, but this is always on the tip of my tongue, which is to really encourage your children to practice self-compassion, right? And I know Yael mentioned this already, but to try to be, as kind, as gentle, and as forgiving of themselves as they might be, with someone that they care about or a loved one, especially now, right? And I know we have so many high-performing and high-achieving students. We have a lot of perfectionistic students, right? And we may have parents and families who expect, perfection and high achievement from their students. And I think, now is as good of a time as any, right, to gradually let go of perfectionism and to recalibrate, right, our expectations for, what's reasonable, right, from a humanity perspective, again, especially right now.
And I would add to that, I guess what comes to mind is somewhat similar for me, but I would say to listen and to the extent that you can, and to validate their concerns. I think I'm quoting from Jeff, who I think said that validation is not agreement, or maybe I'm misquoting, but something like that. So it's not I think an openness, just approaching them with openness and kind of listening to what they're experiencing is really a way to kind of open up a relationship and a connection, and to provide some much needed support.
Wonderful. Thank you so much. And thank you all for joining us today. I know it's difficult to cover everything in just an hour, so I do look forward to future virtual chats with you both, Jeff and Yael, to continue this conversation. Just a reminder, if you do have any questions regarding your students' specific needs or concerns, please feel free to reach out to the CPS team directly, and they'll provide support for any specific requests. I'll be sending out a follow-up email with the recording, the PowerPoint, as well as contact info for our panelists and for the CPS team. So thank you again. Thank you, Jeff and Yael. It was wonderful.
Thanks, everyone. Hang in there.
Yeah, please stay safe, be well, and we hope to see you on campus very soon. Bye-bye, everyone.
Bye.